Welcome to Bloodborne Pathogens training from Kinecta. Today, we'll talk about OSHA's rules on bloodborne pathogen and safe work practices. Before the training is completed, you must demonstrate competency and explain to your supervisor about bloodborne pathogens. Describe how they are transmitted. List cleanup procedures, select appropriate PPE. Apply universal precautions. Understand hepatitis B vaccine, and explain how to respond to an exposure incident. Bloodborne pathogen is a virus or bacteria that is carried in the blood which can cause illness in people. There are many different types of bloodborne pathogens, including hepatitis B, hepatitis C, HIV, syphilis, malaria, and many others. Bloodborne pathogens can be transmitted and enter the body through bodily fluids, by sexual contact, sharing infected needles, getting exposed in the eyes or mouth, open cuts or sores, or cutting yourself with a contaminated sharps or needles. In the workplace, you can contact HIV, hepatitis B, or hepatitis C. Bloodborne transmission comes from one person to another. It's transmitted through blood, blood products, or other components of blood. Bloodborne pathogens. Transmission can happen through saliva during dental procedures, semen, vaginal secretions, amniotic fluid, cerebrospinal fluid, pleural fluid, peritoneal fluid, and synovial fluid. Bloodborne pathogens are not in vomit, urine, or feces, unless they are contaminated with blood. Look for blood in vomit, urine, and feces. Worker protection must be made where there's reasonably anticipated contact with blood or bodily fluids. Types of worker protections include universal precautions, engineering controls, general PPE, work practice controls, hepatitis B vaccine, and when you have potential exposure and you could have contact with blood, gloves and safety glasses are required. If you could be splashed in the face, face shields are required. And if you could be splashed on the body, apron, gown, lab coat is required. Using personal protective equipment means that you should inspect gloves before use, replace gloves that are torn or punctured, remove gloves and goggles before leaving the work area, and wash hands immediately after removing gloves. Universal precautions means that we need to treat all human blood and other potentially infectious materials as though they are infectious. Engineering controls mean that we should remove the hazard or isolate it, such as using sharp disposal containers, self-sheathing needles, safer medical devices, such as needleless systems. Cleanup and safe housekeeping is critical after an incident. The entire area must be cleaned with disinfectant. Cleaning equipment must be disinfected. You must wear gloves while cleaning. Use an apron or goggles if appropriate, and restrict access to the area. Dispose of cleaning materials properly. Decontamination and disinfection must be done as soon as possible. Follow label instructions. Use designated disinfectants. There are several EPA-registered disinfectants. The labels will instruct on how to use properly. Typically, bleach and water, a mixture of 1 to 10 works very well, however, it must be mixed daily. Work practice controls include washing hands after removing gloves, do not bend or break sharps, there's no food or smoking allowed in work areas. This will reduce the likelihood of exposure. Bloodborne pathogen contaminated products must be labeled. They must be on waste containers, sharps containers. Specimens. Storage or shipping containers, and on refrigerators containing blood or biohazard specimens. Hepatitis B vaccine. Must be offered to all employees with occupational exposure at no charge. Employees may decline, but can change their mind later. What does the hepatitis B vaccine do? It simply protects against hepatitis B. There is no vaccine for HIV or hepatitis C. Injury management in the event of an exposure incident is required. If you have contact with blood or other potential bloodborne pathogens through the eye, mouth, or other mucous membrane, or there's non-intact skin puncture with a needle stick or cut by a sharp, you must have a confidential medical follow-up. That's part of injury management. The exposed worker must be offered a confidential medical follow-up with a healthcare professional immediately at no cost to the worker. Best practice is to post the name of the facility for the medical follow-up. Medical follow-up tests are part of injury management, and they require exposed workers and source patients have their blood tested for HIV, hepatitis B, and hepatitis C. Training for employees must be provided for all employees with potential occupational exposure. Initially, upon new hire, and annually thereafter. Also, upon job duty changes, additional training may be required. Always follow these common sense rules. Wash hands. Keep hands away from eyes, nose, and mouth. Frequent hand washing is the best defense against spreading infections. Other hazards include cleaning surfaces, contaminated blood or vomit or feces. Always wear gloves and protective apron or clothing. Be alert for sharp objects, broken glassware. Do not pick up broken glass with your hands. Dispose of glass and sharp objects carefully. Make sure to have linens laundered appropriately. Protect yourself. Use universal precautions. Treat all blood and bodily fluids as potentially infectious. Skin protects from blood-borne pathogens. First aid, use gloves. Wash hands. After contact, flush eyes and face with fresh water. And finally, protect yourself on and off the job. Know the facts. Practice good personal hygiene. Follow work rules. Use gloves and protective clothing. Wash your hands often after work exposure. Keep areas clean and report problems immediately. Now it's time to demonstrate competency and explain to your supervisor about bloodborne pathogens. They will ask you how they are transmitted, and to list cleanup procedures. Appropriate PPE, how to apply universal precautions, if you understand the hepatitis B vaccine, and explain how to respond to an exposure incident. So that's our training for today. You keep safe out there, and look out for one another.